Clinical examination, you need quite a few instruments, and I would request you all to keep your instruments ready at the time of examination. What I have seen during the examination, that the patients are lying on the bed, but student tries to find out instruments from their pocket, and they waste a lot of precious time when every second counts. Now, just to recapitulate, I would show you the instruments which are usually required for a good clinical examination. Now, you all know this is called Sleemo Manometer, and you should be well versed with its use, because sometimes doctors have seen they cannot use this instrument properly either. Now, this is a cotton wool which we use it for superficial sensation. These are common pins which again we use for the sensation of pinprick, and these are toothpicks when these pins are not required. This is a ruler, and we use two rulers for use of to find out the JVP. This is a torch which is required to do the throat examination. These are the perfumes which are required for testing the sense of smell. These are two tuning forks. One is of 128 Hertz and the other is 256 Hertz. These are used for the Rini or the Weber test and to elicit the sense of vibration. Now, this is a classical Patellar Hammer, and one should be very well versed with its use. It is used to elicit the tendon jerks. Now, this is a tape measure which is required to measure different measurements, especially the height and the different size of the limbs. Now, this is an ophthalmoscope which is used to do fundoscopy, and this is an otoscope which is used to see the external acoustic meatus. If we go to this, now these are the tongue depressors which are used to get a good examination of the throat, and these are the test tube in which you can put hot and cold water. This is a chart for the near vision, and its bigger version is the chart. It's called Snellen's chart. That is a stethoscope, you all know. This is a thermometer which is used to record the temperature, and these are the calipers which are used to discriminate, to find out the tactile sensation, 2-point discrimination. That is a goniometer which is used to measure the range of the joint movements. That is a key, and these are the coins which are used for different sensation in the neurological system, especially the stereognosis. And this is a piece of tissue paper, and these are few bottles in which you keep salt and sugar and bitter things for the sensation of taste. So all these instruments should be kept in a bag, and they should be well arranged so that you should know where is your instrument lying, and at the time of examination you should pick up that particular instrument and do the test